Good afternoon. We're here in Chicago with the founders of Caira Surgical, Dr. Morteza Meftah and John Greenwald. Excited to have you guys here and talk about what you're up to today. Maybe a little bit about yourself and how things started.
Yeah, sure. So I'm Mort Meftah. I'm an orthopedic surgeon at NYU, and I also am the co-director of robotics and precision technologies at NYU. And the whole concept of Caira Surgical came about through our frustrations, me and other surgeons with optical navigation. And I was looking around trying to figure out how we can get rid of line of sight issues and all the other aspects of technology that is hurdles for other surgeons. The reason why they're not using computer-assisted surgery for hip and knee replacement. And one big aspect of it was the line of sight and the optical tracking. So we started this company called Caira Surgical with John as our co-founder and CEO, and the concept is to use radar tracking instead of optical tracking, which gets rid of majority of the hurdles that we have with optical navigation. Also, we have other sections of the navigation system, which is intraoperative scanning, which streamlines the registration part. Instead of 5 minutes or so, it gets it down to less than a minute. And going back to the ecosystem that we will discuss later, it's an intraoperative collection of events, such as soft tissue release and such, that predicts the outcome of a hip or knee replacement and ties back with an AI platform to figure out what is the ultimate goal of implant positioning. So it's a multifaceted technology, but use of radar-based tracking and intraoperative scanning and AI-based modeling. The goal is to have a better outcomes after hip and knee replacement. So that's how we started it.
And John, a little bit about yourself.
Sure. So I've been in the orthopedic space 20 plus years, both on the implant side and on the technology side. And what I saw principally on the technology side was a lot of technology that was in the marketplace and sort of trying to get into the clinical space, but it wasn't really meeting the needs from an entire, from the full spectrum of all the stakeholders in the healthcare system, not only from patients to surgeons, to the OR administrators, to the hospitals themselves. So obviously cost is a huge issue, but there's also the complexity that comes along with existing tech, the invasiveness that comes along with conventional optical tracking system that's used now ubiquitous throughout the industry. So when we first met and he had this idea about radar tracking and all of the other sort of peripheral elements that made a streamlined, simple navigation system that is applicable beyond nav into the robotic space. It made a lot of sense, and we could see where both clinically it had a lot of benefits, but then also from a market perspective where it met a lot of the needs that are presently unmet by contemporary technology.
Fantastic. Yeah, I think anyone who's ever been in surgery during a navigation procedure, I was in the early Stryker nav days in mid-2000s, right? 2003, 2004, and it was very dependent upon line of sight, and it almost felt like it needed to be in the perfect position. Obviously, it's improved significantly, but there's still a challenge with, that basic concept of physics. So the radar beacon, as I understand, you'll know where it is no matter where it is in the operating room.
Yes. So radar. It's not totally immune to line of sight, but it's much more serviceable in the operating room environment, in the surgical environment, than the optical systems. It also operates without big pieces of capital equipment, so it streamlines the whole tracking function and also makes it less expensive. We're sort of riding on the back of a lot of the developments around automotive radar, aviation radar, et cetera. The technology, if you had tried to do this 5 or 7 years ago, wouldn't have been achievable. So now we are in a place with the technology where we could, we could find this this application, make this work and functional surgically.
And it's a fundamental problem we have with all of these robotics and navigation. If you look at them, the technology behind the optical tracking has evolved, getting more accurate, but you still have the line of sight. If you look at all of them, the surgical videos that are using some form of robotic or navigation, one side of the OR table is completely empty because the camera has that issue with the line of sight. So hopefully we'll eliminate that completely.
Is it also a challenge with the lighting when you're using an optical tracker? Is that another common problem?
Yes, and also fluid, that yes, blood, exactly, that or anything that actually puts on the spheres and the camera can't pick it up.
Yeah, I mean, they put those trackers very close to the wound. When you're cutting, when you're doing any kind of work, fluid flies around, so you wouldn't have that challenge with a radar beacon.
Not as much, absolutely, yeah. So the constellation, we call it, the different variations of radar that picks up what we call a beacon that attaches into the bone, has so much redundancy that you don't have to clear out one side of the surgical field, which is the goal of us, Caira.
That's great to hear. That's great to hear. I think that'll be a big improvement. So what's your goal as a company? So I think recently you announced a pretty impressive seed round.
Yeah, thanks for that. We closed our seed funding round in December, and actually in January we closed it. And but the goal really is, from a technology standpoint, I think what's keeping technology from penetrating the large joint space is the cumbersome nature of existing tech. So we're working to eliminate that, make it streamlined, cost-effective, simple to use. And so really the goal would be take what is now a 15 to 17% penetration of technology in total joint replacement and expand that out into a standard of care adoption.
And there's no reason why it couldn't work with any enabling tech. It doesn't just have to be navigation or robotics. If you're able to track an instrument, it's a new way of thinking about technology.
Yeah, it's a lot more forgiving to routine things that we take for granted. For example, it goes through cloth and a lot of other things that the optical system cannot achieve. So there's a lot of other potentials of radar tracking that we're still exploring, other than surgical tools in the OR. But it's a wonderful platform.
Very nice. And the team has grown a bit too, right? I've seen some recent announcements.
Yep.
What's the goal for this year? 200, 300?
Maybe that'll be 2024. We'll see. But no, we're really focused on the technology development at this point, and that's where all of the resources are going.
Great. So I can't apply for a job, is what you're saying?
Well, send us your CV. We'll have a look.
Not yet.
No, I really love what you guys are doing. One of the things we've talked about is how the things we're doing kind of have relevance to some of the things you're doing in the ecosystem that we're trying to develop. We just announced our partnership on the 3D printing side. Oh, thank you. It was really exciting to work through that. It's been about a year in the making, and a lot of synergies. But we actually see a lot of the same possibilities with companies like Caira. We've talked about this a little bit on the ecosystem. When the time is right, our goal is to give you access to a large customer base that can adopt, and medical device companies that can adopt and leverage what you're doing. I'd love to get your thoughts on ecosystem and how.
Yeah, I think ecosystem is the future of healthcare. It's not just orthopedics, right? So it's a whole spectrum of. It starts with preoperative optimization. There's a lot of risk stratification tools that comes into play, modifiable risk factors, optimizing patients, and then getting them through surgical journey where they're booked, and then that's where now the orthopedic technologies come in. Better implant positioning, better technologies in terms of cutting tools, robotics and such, navigations, which is where we come in. Tracking tools, augmented reality, which you can see a lot of them at the Academy this year. And then it will continue as how do we capture the post-operative patient-reported outcomes? what are the right questions to ask, what are the right platforms to communicate, how do we make this user-friendly so we can capture not only just routine questions, but some things that are more objective, the gait analysis and their amount of pain or narcotics they're using. And not just for the first few weeks, but extend it to the next year or two afterwards. And what we learned from that, that would loop back into the whole beginning of the spectrum, and that's the ecosystem of what we learn from the outcomes, how we can make it better for the patient's journey.
And I think, being in the device industry, all of us, for a few decades, right? We love the impact we're able to have on the patient, on the surgeon's life, right? A few extra minutes per surgery means extra half hour at the end of the day with the family, right?
Of course.
So it's something we all probably have been in and dedicated our lives to because we love it so much. It's great to see folks with great experiences and understanding of the technology and building something amazing. So thank you for tackling this.
Thank you so much.
Great
Thanks
to
for
be
having
back.
us.
Thanks, Peter. Thanks for having
Thank
us.
you.
Awesome.